So when I am doing a head-to-toe assessment on a patient, the first thing I'm going to do when I enter the patient's room is introduce myself and make sure that it is the right patient by using two patient identifiers, which is the patient's name and the patient's date of birth. So, hello, I'm Jamie. I'm going to be your nurse for today. Can you please tell me your name and date of birth?
Michael Rivard, 2/10/2003.
All right, and I will be checking that on the medical records I have brought in and make sure that what he is telling me is the correct information. So what I'm going to be doing today is assessing you from head to toe. I'm going to assess your cranial nerves, make sure they're all functioning well. I'm going to listen to your stomach sounds, your lung sounds, and your heart sounds, and make sure that everything is sounding the way it should be. So we're going to start off with the cranial nerves, and I'm going to start off with cranial nerve number 1, which is your sense of smell. And what I would like you to do is I want you to close your eyes and plug one nostril for me, and I'm going to hold something up to your nose, and I want you to tell me what that is. All right?
Okay.
So can you please do that?
Sure. Taco.
Very good. And can you please do that with your other one?
Cinnamon.
Very good. All right. And I will also be observing his face, making sure that everything is symmetrical, that not one side is higher or lower than the other. I will be looking at his ears, his eyes, his cheeks, and making sure that they're all on the same level and nothing is higher or lower than it should be. So next, I'm going to be assessing your cranial nerve number 2, which is assessing your visual fields and your visual acuity. I don't have it here with me, but I would have him look at a Snellen test, and I'd say, okay, I want you to cover one eye. So cover one eye. And then I would have him tell me what line he could read off the Snellen test. And then I would have him stand 20 feet away from the Snellen test as well as he's reading it. And then I would say, all right, now can you please uncover that eye and cover your right eye now and tell me which line you can read. And once again, I'd have him read the Snellen test and which line he could read off of it. And based off of that, I would be able to tell what his vision is, whether if it's 20/20, 20/30, whatever the Snellen test tells me it is. And then next I would give him like a smaller chart, and I would have him hold it 14 inches away from his eyes, and I would have him cover one eye and tell me what he could read off of that, and then I'd have him cover the other eye and then tell me what he can read off of the chart that I gave him. All right, good job. So next, I would be testing his visual fields, and excuse me, sir, and you can put your hands down now. And so I'm going to be testing your visual fields, and what I'm going to have you do is you're going to be looking straight at me. You're going to be looking straight at me. You're not going to be looking at my fingers, but as you're looking at me, I'm going to be putting up a certain amount of fingers in each corner of your visual field, and you are going to tell me how many fingers I am holding up, and you are going to be looking straight at me all the while. You're not going to be looking at my fingers. Does that make sense? Okay. All right, so looking straight at me.
3.
Okay.
2. 4.
All right, very good. So next I'm going to be assessing your cranial nerve 3, which is your pupil reaction. And I have this pen light, and what I'm going to be doing is I'm going to be shining a light into each of your eyes, and I'm going to be watching how your pupils react to that. So if you can just turn to me. All right, and both pupils are constricting normally, and they both are equal constrictions, not one pupil constricts smaller than the other. They're both equal and normal, And then next what I'm going to do is I'm going to shine the pen light into the center of your nose, and I need to check the reflection of the light in each eye, and I have to make sure that they're in the same spot. Alright, so if you turn to me, please. Alright, and both eyes had the same light reflection, because if they were not the same, that would tell me that one eye is not at, that the eyes are not at the same level, and so that would have to be written down and charted, but they are both normal, so yep, and I will just chart that down as well. So next I'm going to be assessing your cranial nerve number 4, and what I'm going to do is I'm going to have this pen light, and I'm going to have you look at it, and I'm going to bring it to your nose, and you're going to follow it all the while. I'm going to bring it to your nose and then bring it back out. All the while I want you to focus on it and watch it with your eyes, okay? Very good. And both of his eyes followed it normally. Yeah, nothing seemed out of place. They both followed it at the same time, and they are normal. So I'm going to be assessing your 5th cranial nerve. And what is that going to do? I'm going to be assessing your muscle movement and making sure that everything is nice and even. I would also test your corneal reflex, which I just did with the swinging test of the pupils. So what I'm going to have you do is I'm going to have you clench your teeth. So I want you to clench your teeth, and I'm going to feel along there and make sure that the muscles are nice and even. And then if you can puff your cheeks out, frown, smile. Very good. So next I'm going to be assessing your cranial nerve 6, and that will be once again your eye muscles and movement, making sure they're both moving at the same time, and yeah, that they're functioning normally. So I'm going to have this pen light, and what I want you to do is I want you to follow it with your eyes, okay? I'm going to do 6 different areas I want you to follow it into. Very good, and I didn't see any abnormalities. Everything looked normal and good and healthy. So next what I'm going to do is test your cranial nerve number 7, and that is your sense of taste. And what I'm going to do is I'm going to give you something to taste with your eyes closed, and you're going to tell me what that is. And all the while I'm going to take my pen light and I'm going to inspect the inside of his mouth. So if you can open your mouth for me, please. And I'm going to open your mouth, please. I'm going to be inspecting his tongue, counting his teeth, making sure that he has the appropriate number of teeth for his age, and I'm going to be looking at the mucous membranes, making sure that everything looks the way it should. And so next I'm going to be testing your sense of taste. So if you could close your eyes and open your mouth for me, please. Okay. Do you want to try it again?
Tastes like cookie batter.
Very good. I'm going to be assessing his cranial nerve number 8, which is his hearing and sense of balance. His sense of balance, I would have him stand up straight with his hands at his side, and with his eyes open, I would count to 30 and make sure he's not like swaying around or looks like he's about to fall. And then I would have him close his eyes and once again count to 30 and make sure that he's not moving around a whole lot and looks like he's gonna fall. I would then assess his ears by looking into the ear with an ophthalmoscope, and I would pull upwards and backwards and look into it, make sure that everything looks nice and normal. And in the left ear, I would see a light reflection at a 7 o'clock angle. And in his right ear, I would see a light reflection of a 5 o'clock angle. So next, I'm going to be testing your hearing. So what I want you to do is plug one ear for me, and I'm going to whisper 2 words, and I want you to say them back to me, okay? All right.
Playground.
All right, now if you can cover your other ear for me, please. Thank you.
Kickball.
Very good. So with his cranial nerve number 9, I'm going to be assessing your sense of taste on the back part of your tongue, and I'm going to be assessing your ability to swallow. So what I want you to do is once again close your eyes, and I will have you taste something for me. Open your mouth for me, please, and I'll be putting it in the back portion of your mouth. And what does that taste like?
Frosting.
All right, and I can see that he is swallowing it without any difficulty, and he has a normal swallow reflex, and his taste in the posterior part of his tongue was well and normal. He guessed it right, it was frosting. Next, I'm going to be assessing his cranial nerve number 10, which I have been kind of assessing the whole time while talking with the patient and assessing him, because the 10th cranial nerve is assessing his vocal cords and making sure that he's talking normally, and that he's saying everything rightly, like there's no slurring, there's nothing abnormal going on with his vagus nerve, and so I was assessing that the whole time, but I would like maybe ask him to repeat a few words back to me. So if you can say hot dog,
Hot dog.
playground,
Playground.
toy store.
Toy store.
All right, and everything seems to be working normally for him, and yep, his vagus nerve seems to be going very good. Next, I would be testing his cranial nerve 11, which is assessing head and shoulder movements. So if you can just repeat the actions after me, if you can touch your ear to your shoulder on both sides without lifting your shoulder. Very good. Looking up and down. Good. And then I'm going to be applying a little bit of resistance to his shoulders, and as I push down, I want you to give me a shrug, okay? All right, and that was normal. And next I'm going to be doing cranial nerve 12, which is simply, can you stick your tongue out at me? Very good. And that is the end of assessing the cranial nerves. So next, what I'm going to be doing is I'm going to be assessing your gait, meaning I'm going to have you stand up for me, please, and I want you to just walk back and forth like you typically would. You can swing your arms or just walk back and forth for me. All right, and everything is good. His gait is normal. He's not, all right, you can sit down now. His gait is normal. He's not like tripping around. He's not tripping over his own feet. He's not like leaning over to one side more than the other. And I was also, assessing like how I was assessing his shoulder symmetry, making sure that his shoulders are normal, making sure that not one leg is longer than the other, and everything looks normal. So next, what I'm going to be doing is I'm going to be listening to your heart sounds, your lung sounds, and your bowel sounds, which is the stomach sounds. And while I'm assessing him, I'm going to also be assessing his arms, making sure that there's no like scars or lesions or any discoloration, and making sure that everything it looks normal and healthy like it should. I'm going to be assessing his lungs first, and what I'm doing is I'm inspecting first, once again making sure that everything looks normal, And then I would palpate the back. If you can just lean forward a little bit for me, just stand up straight. I would just be palpating around and have him take deep breaths for me. So if you can take a deep breath for me. Yep. And making sure that everything feels good and normal, and that I would be percussing. I would be feeling along, making sure that nothing is like stiff or weak, making sure that I'm not making him like cough or whatever. And then I would feel along for the, and I would have him repeat some phrases for me. So can you say blue moon?
Blue moon.
Say it again.
Blue moon.
And again.
Blue moon. Blue moon.
All right, and that will tell that I was feeling the vibrations of his lungs, making sure that everything is as it should be. So next, what I'm going to be doing is I'm going to listen to his lung sounds, and I'm going to first listen to the brachial section, which is up here, and then the brachiovascular section, which is over here, and then the vascular section, which is this area. And so I would put my stethoscope on, and I would start over here, and all the while I would have him breathe for me normally. And then I would do the same to the back part of him, starting up here. All right, and as I am listening to his lung sounds, I'm making sure that I can't hear any wheezing or crackling, and I will be listening to his inspiration and expirations and making sure that everything sounds normal and healthy, and it does. So next, I will be listening to his heart sounds, and I will be listening to, 5 different places for his heart sounds. I will be starting with the apical, the pulmonic, the Erb's point, the tricuspid, and the mitral. And what I do is I start right here for the apical, then over here for the pulmonic, and then this is the Erb's point, mitral, tricuspid, and then mitral. And then I would inspect his stomach. What you do with the stomach is you first inspect it, making sure that his stomach is a normal color, that it doesn't have any wounds or anything abnormal. Then I would auscultate the stomach second, because if I percussed it and palpated it before I auscultate it, that is going to change the way his stomach sounds are. As I listen, I would expect to hear around 15 to 25 vowel sounds in a minute. If I cannot hear any, I will have to listen at each section for about 5 minutes. And what I would do, he would be lying down first off, but I don't have anywhere for him to lie down, so we're just going to say that he's lying down. And as I listen, I'm going to start right here and listen, move up to here, listen for a minute each time, move over here and listen, move over here and listen, and then I would use a bow and I would listen to the arteries, which is right here, here, and here, and make sure I don't hear any bruits. Then I would palpate his stomach and just feel along each quadrant and make sure that everything feels normal. Make sure I'm not feeling any masses or any swelling anywhere. Just making sure that I don't have any abnormal findings. And then I would percuss, and I would like put my middle finger on each area and I would hit on it. And if I were to hit it over here and he had pain on this side of his stomach, that would tell me that he was having an appendicitis. And that is the end of my head to toe assessment video. So thank you.